is congestion and the hemorrhage, out of which we are dealing with congestion. So the infarct. So what is the infarct? The infarct is an area of ischemic necrosis caused by occlusion of either arterial or a venous arterial supply or a venous flow. And the process underlying this infarct is called as an infarction. So here we are studying a gross pathology of a splenic infarct. Yeah. So this is the slice of spleen having this notch. This is the capsular surface of the spleen, and below the capsular surface you can see a plain conical white area which is slightly depressed below the surface. This is the picture. You can be seen into the specimen. I will show that specimen on a web camera. And this area, a triangular area, is called as splenic infarct, always has a base towards the capsular surface, and the apex is towards the hilum, where the blood supply. So in any organ, usually the base is always toward the capsular surface and the apex is toward the blood supply. Always any organ has a hilum through which the venous and arterial supply comes to that organ. So this is just I have talked to the gross appearance. This is a slice of spleen measuring 12 by 6 by 1. On the external surface a capsule. So whenever there is an infarct, capsule has no role. It is always smooth. And on the capsular surface or on the cut surface, you always get a wedge-shaped area of discoloration, a white discoloration, which appears as a tail, shrunken and depressed below the surface. Yeah. The area is well demarcated by a line of inflammation and the congestion. Now the etiology, as you know, it's mainly caused due to the sudden ischemia. So that's an important thing. Usually it is due to the thromboembolism. The causes you are dealt in the lecture is how does this thrombosis and embolism occurs. So some of the causes you must know, that is bacterial endocarditis, polyarthritis nodosa, that is a vascular disease, or a neural thrombi from the heart may pass into the systemic circulation and lodge into the distant organ. Other local causes at the organ level, these are vasospasm or hemorrhage into the atheromatous plaque causing thrombosis at that site, or the vessels which are supplying to that organ are constricted from outside, maybe due to the enlarging tumor mass, or one of the common things we know, that is a torsion of the vessels. Now usually the best example are testicular torsion or bowel volvulus. Here this vascular comprise due to, and this additionally during this compression or torsion there is always an edema. Yeah. So pathogenesis, a sudden blockage of artery or vein, and this causes the focal cell death, followed by degradation of the tissue by hydrolytic enzymes liberated by the dying cells, and on account of reduced blood supply, what we call as ischemia, along with, and this causes ischemic injury causes a denaturation of the protein of the cells, causing necrosis. And all this area is usually surrounded or encircled by an zone of inflammation, and that is the margin of the infarct area. Now, other changes which we can see in the organ, they depending on the color or presence or absence of infection, the infarct can be categorized into the arterial or called as a white infarct or anemic infarct or a red infarct or a hemorrhage. Usually the white infarct, there is arterial occlusion occurring usually in the solid organs like heart, kidney and skin. If there is a blockage of the venous drainage in the organs like ovaries, lungs, small intestine, which give rise to the red or a hemorrhagic infarct. So the appearance of infarct, whenever there is an arterial blood supply stop, the infarct is always pale and white. That's why it is called as anemia. In case of occlusion of venous drainage, the blood gets stagnated into the organ, and that causes the hemorrhagic necrosis and the infarct of that organ. So common example that is gangrene intestine, where mesenteric vein thrombosis occurs and you get a hemorrhagic infarct of the small bowel. So it is a red infarct. The other sites of involvement of kidney and heart. Now, what are the complications or outcome of this infarct? Now, usually you see this is the injury to the organ and the cells in the organ, which uh, again get healed by first inflammation, then regeneration or fibrosis. Regeneration is mainly by fibrosis. So the infarcts are later on healed by fibrosis. So if this infected area get another or get infected with the bacteria or other infective organisms, then this infarct area get liquefied and causes abscesses in that organ. Usually the post-infarction splenic rupture or hemorrhage is quite uncommon. Now the first, so we have seen the gross pathology of the infarcted spleen. In fact, microscopy of the infarcted spleen is not for your study. Now we go on a second example of the infarct that is the most common, that is myocardial infarction. Now here there is a microscopic slide of myocardial infarct. So these are the normal muscle fibers, syncytial normal muscle fibers. And below that, here the muscle fibers lose their eosinophils and their margins are irregular. And this is the infarcted area. Yeah. So in case of infarct, in infarction, the necrosis is a coagulative type of necrosis, where protein denaturation occurs. The cellular outlines are maintained, but the cellular and the nuclear details are lost, and that gives the organ the tombstone appearance on microscope. Right? So the cells are swollen and appear more eosinophilic than the normal, and may be infiltrated by inflammatory cells. So these are the normal cardiac muscle fibers. But here The cellular outline of the cardiac muscle fibers are maintained, but the details, cellular details, cytoplasmic as well as nuclear details are totally lost. So this is the tombstone appearance. Etiology, as you know, mainly a cardiac coronary artery thrombosis or rupture of atherosclerotic plaque into the major coronary arteries or coronary artery vasospasm, yeah, or emboli from endocarditis. Now the risk factor we have studied like dyslipidemia, hypertension and smoking, which leads to atherosclerosis and secondary thrombosis and embolism. Now lastly, as I said before, what we have studied that circulatory disturbances means any obstruction into the circulatory system, either in the arterial side, that is on the left side of the heart, or right side of the heart, or the venous side, it will lead to another. It will lead to either infarct or one another entity you must know, that is chronic venous congestion. So usually chronic venous congestion is due to the venous blockage, where the organs are drained by the venous, which are blocked, the veins which are blocked. Below the blockage, whatever the organs are there, they get the blood from that organs are not goes or not go into the right side of the heart, and they get stagnated into the organ, and that stagnation we call as congestion, and that process is chronic. So that's why we have this terminology, chronic venous congestion. Now, an example we will study, that is chronic venous congestion of the liver. Another examples are there, that is chronic venous congestion of the lung. So the in chronic venous congestion of liver occurs mainly due to the right heart failure. So if the right side of the heart is not working, then the blood gets stagnated the first organ, that is the liver. Then in the legs or lower part of the body. Yeah. So right heart failure, or there is some blockage into the inferior vena cava, or blockage in the hepatic vein which drains into the inferior vena cava. So in such a cases, right side failure, the main organ is affected and the pathology seen is the liver. So the liver in such a case, due to the stagnation of blood into that organ, it gets enlarged. The capsule becomes tense. The cut surface shows characteristics red and yellow mottled appearance. Now why it is red and this appearance, that is red yellow mottled appearance? It is due to the congested center of the lobules. So liver, you know, on microscopy has lobules which are at the corner ends. You have hepatic tract, and in the center there is a central vein. So the congestion, so the blood enters from the periphery into the portal tract, and it is drained toward the center of the lobule, and through the central vein it is drained to the right side of the heart. If the right side of the heart is filled, then the blood gets stagnated into the center of the lobule. So that's why that red dots are seen. Yeah, and due to the stagnation, there is a hemorrhage around the centrivenular area, and there is a hypoxic injury to the hepatocytes surrounding the central vein area. So the hepatocytes get necrosed. The area are away from or peripheral area of the lobule suffers less because from the periphery blood is going down toward the center. But there is always chronic hypoxia to the peripheral. So around this central red area, the peripheral hypoxia causes the fatty change into the peripheral zone. And fatty change is yellowish. So the liver parenchyma has red and yellow dots. And that's why it is always called as a nut to make the liver. Yeah, we will have a question what is a nut make liver. It is seen in chronic venous congestion. So this is the gross specimen of a liver size. You can see if you see carefully a small dotted pale yellowish areas. Yeah, the red dot is fade away because it is in the formalin. Here you can see mottled red and yellow area. So yellow areas are the peripheral fatty change and the central hemorrhagic necrosis. So this is a nutmeg appearance on a fresh specimen of chronic venous congestion of the liver. Now this process is acute, so it has given a best pictures. So these are the peripheral zone having the fatty change and the necrotic, hemorrhagic necrotic central zones. So if you study the microscopy, so this is a liver, slice of liver, you can obviously identify. So this is portal triad area. These are portal triads. And this is the central vein. So blood is going through the from the periphery to the toward the center, and here it is going. On the right side heart failure, the blood, this drainage is blocked. That's why blood oozes out around this central area surrounding the central vein. So here there is a hemorrhagic necrosis and congestion occurs. On the peripheral, you will get a fatty change of liver due to the chronic hypoxia. So here this area, here this is area. So the histology we have just stopped. So there is a centrilobular zone due to the severe hypoxia, then into the periphery. The central vein as well as the adjacent sinusoids are distended and filled with the blood. This is due to the venous blockage or right side heart failure, or there is a blockage into the peripheral vena cava or a hepatic vein. So the drainage from the liver is compensated. So the centrilobular hepatocytes undergo degenerative changes and eventually there is a centrilobular hemorrhagic necrosis which gives nutmeg liver appearance. In long-standing cases, show the fine centrilobular fibrosis. The healing always start that, so it is healed by centrilobular fibrosis and regeneration some of the hepatocytes. The peripheral zone of the lobule is less severely affected by chronic hypoxia and shows some fatty change into the hepatocytes. So this is the histology of chronic venous congestion of the liver. Yeah. The etiology. So whenever there is a right-sided heart failure, the causes you can read of right-sided failure, that is a pulmonary embolism, pulmonary stenosis, emphysema, chronic bronchitis, pulmonary tuberculosis, cystic fibrosis. Another element is occlusion to the inferior vena cava or the hepatic vein. And thirdly, a Budd-Chiari syndrome. It is a separate syndrome. You should study from the book what is there. The pathogenesis, it is a very obvious, that is a right heart failure. and due to this there is a back pressure into the inferior vena cava and hepatic veins and in the central veins of the liver, which gets congested, and the area around the central vein gets anoxic, and there is a centrilobular hemorrhagic or anoxic necrosis, and in the peripheral zone or in the mid zone, you will get a fatty change, and further peripheral zone is in normal appearance. So this is the pathogenesis of the CVC line. Now, such changes can be occurred into the other organs like lungs, spleen, and kidneys. Now, there are other diseases where similar changes can be seen, that is the centrilobular necrosis. So, centrilobular necrosis of the liver can be accompanied or can be seen in aflatoxin-induced poisoning, or which shows the centrilobular necrosis, a similar nutmeg appearance, or calcium tetrachloride poisoning, which induces the fatty change. Now, what are the symptoms? The symptoms are usually of a right-sided heart failure, that is the pedal edema, hepatomegaly, and raised jugular venous pressure. Okay. Now, now I will try to show you the actual specimen which of spleen infarct, the gross pathology of a spleen infarct on a web camera. You can तो दूसरा स्प्लीन सर है इकडे जा रिझर्व बाजूला नाही का ते जरा जरा हे काढकी हा बरोबर दरवाजा बंद कर नाही रे तसं काय त्यांना ते दिसणार नाही असं स्पेस आहे. So this is the so this is the slice or capsular area of the spleen. Now in this picture you cannot see a detailed demarcation of the white area. In actual specimen on the capsular surface, I can see irregular wedge-shaped areas of pale white areas over the capsular surface. If I turn on the cut surface, so above this is the capsular area, and just below that where my finger is, there is a depressed pale white area. The margins are well demarcated. So this is the splenic infarct, which has the base toward the capsule and the apex is toward the hilum. Okay. The specimen. So yet there is we are trying to show you, but this camera, here you can see. So this is a slice of specimen. So this is the capsular slice of spleen. This is the capsular area. Now here you can see a vaguely a triangular area which has these white borders. Now this area is depressed and which has a base towards the capsule and apex is towards the hilum. So all this you can see better there. So these are the white areas, infarcted areas which has broad infarct over the in the spleen which has base toward the capsule and this apex is towards the hilum of the spleen and whole this area in the actual specimen is just depressed below the normal spleen parenchyma. So this because the infarct in infarct areas there is a cellular necrosis and the area becomes soft, so it gets depressed below the normal surrounding tissue. Can you appreciate this? You can appreciate this. So this is the spleen, a slice of spleen 12 by 6 by whatever the measurement. So this is irregular pale infarct areas. Here you can see this now, this specimen. So the first specimen, so this white area marginated, so this is actually zone of inflammation. This area is just depressed below this normal splenic parenchyma. So this is an infarcted area. Yeah, base is toward the capsule and the apex is towards the hilum. Now, I will try to show you the two slides, actual slides of chronic venous congestion of a liver and myocardial infarction. Last time also you have studied this slide under the coagulative necrosis. But just I will revise this slide. Now first we will show the actual microscopic of the chronic venous failure. ते आपलं ऍप चालू करायचं स्लाइड दाखवायचे आता हे कॅन्सल करा बरं आणि पूर्वीचं माझं जे सेशन आहे ते स्लाइड चालू करू नाही माझं सेशन त्याच्यामधलं ऍप येईल की ते ऍप चालू करतो म्हणजे माझं तिकडे दाखवतो हा हा ह्याच्यात पोरं आहेत पण ते काय कळत नाही की सर काय 40 जण पार्टिसिपेट किस काय घातली हा नाही बॅक जवळ नाही बॅक म्हणजे मेन स्क्रीनला हा इथं चालू हेच नाव आहे हा take कॅमेरा हा एक मिनिट सर बरोबर चालू केलं सर बोलून तुम्ही करू शकता सर कॅमेरा
That's it. It's a sir.
Okay, now this is the slide of myocardial infarction you have studied in the coagulative necrosis. Now this area which I have projected, so this is the normal syncytial myocardial muscle fiber. But as you go toward the right, the cellular outlines are maintained, but the cellular details, yeah, or cytoplasmic details are lost, and there is a vacuolization. Now, this slide is of field myocardial infarction, not a fresh myocardial infarction. So, as I go right, now you can see the difference. Here, you can see a viable cardiac muscle as I go towards the right side. So this is the fibrous area. Here the myocardial muscle fibers losing. So counter is maintained, but the cytoplasmic and nuclear details are lost. This is due to the coagulative necrosis and due to the ischemic injury due to the myocardial infarction. So this is the fibrous area. This is healing or healed myocardial infarction. So this is infarcted area. Yet cellular details are lost. The cells myocardial fibers has becomes intensely eosinotic. So this is there is a fibrosis. So this is an infarcted area. Right here it is a normal area. You can see. So normal myocardium you are seeing in anatomy or histology. Now another slide I would like to show you the actual slide photographs of chronic venous congestion, mainly due to the right side of heart failure. This is the scanner view. So the lever you can make out sinusoidal pattern. So this is the centrilobular area. You can see there is a congestion and hemorrhage and necrosis of the hepatocytes. I will go to the low power. Let's see. So this is the centrilobular area where there is congestion of the sinusoid, there is stagnation of blood into the sinusoids, and there is a hemorrhagic hepatocellular necrosis, and there may be one outline of a central vein. Yeah, so this is the centrivenular area where there is a stagnation of the blood arteries and centrivenular necrosis. And this is the mid zone, this is peripheral zone. This is another centrilobular necrosis in adjacent lobule. And this is the CBC line. You can see this is a portal triad of one of the hepatic lobule. तिकडे काय चालू नाही आपल्याला दिसत नाही. So this is मला ते सगळं प्रॉब्लेम होतो. So this is the CVC lung where you get The window
अभी अपडेट
update
होता है इतना अपडेट
So this
और
is
आप
the
देखो
centrifugal necrotic area or centrifugal
हाँ
necrosis. काय त्याच्यामुळे
आम्हाला सारे विंडोज अपडेट आले
काय पळा
त्याचे खाली काय
स्लाइड
पडले पोस्टपोन आणि रिस्टार्ट ना पोस्टपोन करू हाँ
So this is the large centrifugal necrotic area. There is an arrow there. You can see. So these are the red dots, and this is the yellowish thing that is due to the fatty change or the normal hepatic pattern. So this is chronic venous congestion of the liver. This is the capsular area, and so this is the peripheral area, which is normal. As you go inside into the lobule or center of the lobule, you will get centripetal necrosis, and that is the sign of the chronic venous condition of the liver. The center of the lobules, they get necrosed, the peripheral zones and mid zones are unaffected and gives the nutmeg appearance. Okay, thank you all of you. बरोबर घेतलं